Assalamualaikum and good morning to the honorable judges, loyal timekeeper, lecturers and all my fellow friends. I am Noor Aishah along with me Faizah Amran will present our elective research project entitled Exploring Dental Hygiene Practice Among Removable and Fixed Prosthesis Patients. Before I start, I would like to thank our supervisor, Dr. Nik Rahayyu and Dr. Aiemeeza for their support in our research. Ladies and gentlemen, adolescence is a biological sequence of human aging with dental caries and periodontitis as the most common etiological factor. Nowadays, numerous prosthetic options are available for tooth replacement such as removable prosthesis and fixed prosthesis. So when the edentulous or partially edentulous patient are getting their prosthesis, the important phase which is oral and denture hygiene begins. Many problems usually arise in prosthesis wearers who have poor oral and prosthesis cleanliness. A study from Petter et al. Stated that even though prosthesis had a desirable pontic design and good material selection, oral hygiene measures still necessary to avoid problems such as bacterial plaque accumulation, mucosal inflammation, and halitosis. Patients are usually instructed on denture hygiene practice during insertion of the denture and maintenance appointments. It shows that cleansing and disinfection of prostheses are needed for the maintenance of oral health and treatment success. Now that we are familiar with the background of the study, we can move on to the objective. Our objective is to assess patient awareness and knowledge regarding their dental hygiene practice. We also want to determine their dental hygiene practice on the prosthesis. Moreover, the difference in dental hygiene awareness, knowledge, and practice may be related to a number of factors such as education, gender, and age.
For methodology, firstly, we randomly select patients that had undergone treatment of removable and fixed prostheses prescribed by undergraduate UiTM dental students and private clinics. For the sample size, the calculation was performed using EpiInfo version 5.4.2 and we get 130 subjects with consideration of 5% dropout. And then it was then divided into two groups which were removable and fixed prostheses. After obtaining the ethical approval from the Research and Ethics Committee UiTM, we proceed with extraction of patient information from Integrated Dental Record Management System items, and then we distribute the survey to all the subjects. Subjects were personally approached over the phone via WhatsApp or phone calls, and they were needed to answer the survey through a Google form. After the data collection complete, the data was analyzed using statistical analysis and SPSS 26 version software. So I will proceed with the results. The response rate of the present study was 65%, which is 85 subjects out of 130. And then table 1 shows the demographic information of the subjects. We can see that females were in greater proportion compared to males, and then out of 85 subjects, 80 of them had their prostheses made in UiTM Dental Center and 5 of them were made in private clinic. For the type of prostheses, 48 of the subjects were removable prostheses and 37 of them were fixed prostheses. Table 2 shows the awareness and knowledge for dental hygiene with respect to gender. We can see that more than half of the participants agreed their dentist advised them to book for recall visits. And then, greater number of males and females reported never experienced bad breath while using their prostheses. The bad breath experience of the subjects did show a significant difference where females respondents had a higher percentage of never experienced halitosis compared to males. And then, majority of the subjects also reported that they know unhygienic prosthesis can be a source of infection. Table 3 shows the dental hygiene practice among removable prosthesis patients. We can see that majority of the subjects prefer to clean their prosthesis by brushing and soaking. And then for the frequency of prosthesis cleaning per day, mostly clean their prosthesis twice a day followed by once a day. And then 79.2% of the subjects do not wear their prosthesis overnight. However, 20.8% of them still wear their prosthesis to bed. Figure 1 also shows the dental hygiene practice of removable prosthesis patients. We can see that majority of male and female immerse their prosthesis in plain water after removing them from the oral cavity. Table 5 shows dental hygiene practices in fixed prosthesis wearers. We can see majority of them clean underneath their prosthesis and mostly use special dental aids to clean underneath their prosthesis. Figure 2 shows the type of special aids used in fixed prosthesis. Majority of the females choose floss, while males choose super floss and interdental brush to clean underneath their prosthesis.
We will continue the discussion of the research according to each domain. First and foremost is the patient awareness and knowledge regarding their dental hygiene. We all know that prosthesis hygiene education is the utmost important part of therapy and essential for the maintenance of oral health. From our study, 80% of our respondents never experienced bad breath while using the prosthesis, and the bad breath experience of the subject did show a significant difference, where female respondents had a higher percentage of never experienced halitosis compared to the males. And the same finding we found in Citier et al., where 58% of male had self-persist bad breath compared to female. And this may be attributed to many factors. Possibly female subject practice better dental hygiene compared to male. Next, our study shows that our subject had a good knowledge because majority of them realized that unclean prosthesis can lead to infection. It means most of them are aware and know the importance of prosthesis cleanliness, but almost half of respondents neglect the importance of dental visit, especially when they do not have problem with their oral health. It is contrary to a study by Shankar et al., where mostly the patient visit the dentist 6 months and 1 year after the treatment. Our respondents should know that regular dental visit will allow dentists to monitor a patient's oral health. In removable prosthesis wearer practice, it shows that the respondent had a better practice in taking care of their denture hygiene. It is because they prefer combination technique of brushing and soaking when clean their denture. Although the previous study by Chakan and Martini et al. Reported that the method of choice to cleanse prosthesis was brushing, and care of prosthesis and the mucosal tissues of edentulous mouth important for oral health. Next, the frequency of denture cleaning was significantly higher in females than males. This may be because women value cleanliness and hygiene more than men. This is similar in study by Chaudhary et al., where female patients had higher rates of good and fair hygiene than males. Most important is habitual practice of cleaning and frequency may attribute to the longevity of the prosthesis. And although a majority of our respondents remove their denture overnight, but there is still 20.8% of our subjects wore them. It is because they prefer to wear them while sleeping on their own. But this situation is better than those reported by Baran and Nalkaki et al. In 2009, which stated that 55.2% of the subjects still sleep with their denture. Now, let's look at dental hygiene practice on fit prosthesis patients. From the result, we can conclude that our patients have a better practice of their dental hygiene comparing to other studies. It is because almost 89.2% of our patients use special aids to clean underneath their prosthesis, and the most common use is floss and interdental brush. It is different from study by Al-Kaba and Bashi et al., where 94% of their patients did not use any form of interdental aids to clean their fixed prosthesis because they thought it is not important, and some of them also claimed that they were not informed by the dentist and did not know how to use them. To express our view, patients with fixed prosthesis require a regular, lifelong professional maintenance providing repeated oral hygiene intervention and instruction regarding proper oral hygiene. And the use of interdental aids such as floss, superfloss, and interdental brush can improve the biological maintenance of the fixed prosthesis.
As for the conclusion, majority of the patients had good dental hygiene awareness, knowledge and practice. Despite this, minority of them were still not complying with the good dental hygiene even though dentists had given instruction. Because of this, dentists should emphasize a better practice among patients by reinforcement activity and allocate more time for education. These are our references. With that, I want to thank you all so much for your kind attention.